Ilene, and I'm with Group 8 with DeAndre and Hannah, and we'll be working on the project for Equine Infectious Anemia. Beginning on the etiology, Equine Infectious Anemia is a lentivirus form, the retroviridae, that targets the equidae of species. This virus persists in the blood of the equine throughout its whole lifetime once contracted. So once they get it, it becomes part of their DNA, and it just stays with them forever. So it's best to keep the horses that do have this away from all the horses that don't. All equids infected with EIA virus remain lifelong carriers that can potentially pass on to another equine. Next is the transmission. The transmission of disease is mechanically passed on via bite from mosquitoes, horses, stable or deer flies. This disease, however, can't be transmitted to humans. Transmission of the infection is common in hot, humid countries, which would influence the fly population and generate a lot of bite cases throughout the herd. So their favorite environment would be that of desert-like. It can also be transmuted throughout the herd from unsterilized needles via blood transfusion from iatrogenic methods. A pregnant mare who have EIA can infect the newborn foal with disease. So it's not spread by contact, but by blood. Body tissue fluids should also be regarded as potentially infectious. Next is the clinical signs. Acute, which are rapid onset of fever, severe weight loss, depression, excessive thirst, extreme weakness, anorexia, odemia in the lower abdomen, and there are more that aren't listed. And for the clinical signs, subacute are relapsing fever, an increase in the ESR. Signs are similar to acute clinical signs, and anemia. Next are the chronic clinical signs. Intermittent fever, edema under thorax and abdomen, lethargy, enlarged spleen and liver, jaundice, and muscle weakness. And next is the diagnosis. For the diagnosis of this illness, Coggan's test is one of the most active ways in diagnosing an adequate for EIA from a serum test. More than 1 million horses are screened for EIA every year. And to diagnose this virus, the serological tests are done. And a positive test can confirm that the presence of EIA specific antibodies are there. And for the next page, we're talking about the treatment. There is no known cure for the EIA illness, and only plausible treatment for this disease is isolation from the rest of the herd in order to control the spread of the disease from the positive antibody horse, or by euthanizing, which a lot do not want to go to. Good management practices can also influence the infection rate on the farm annually, testing horses and sterilizing tools, along with quarantining new horses for 45 days for any signs of illness. And for the justification, for the prevalence, the virus is mostly spread by horse flies and deer flies, which are blood-feeding insects, but blood transfusions, and contaminated instruments such as blood-contaminated needles can transmit the virus as well. For the zoonotic potential, this disease cannot be considered zoonotic. Therefore, this disease cannot be transmitted from an animal to a human. And for the mortality rates, the morbidity and mortality rates vary, and mortality rates are as high as 80%. This disease is important for the equine species because when the owner becomes aware of this disease and illness, which does, however, brings the owner to awareness, and then therefore shows it what is caused by it and what it does, and thereon they can take action to help prevent the disease, such as controlling flies and keeping horses that are contaminated away from the rest of the herd. To prevent EIA, infectious horse owner encouraged to practice good fly control require proof of recent negative Coggins test at time of purchase or for new horses entering the premises, use of sterile needle and syringe for all injections or treatments. They can also separate those horses that seem ill away from the rest that are not, and they can also only participate in events that require evidence of a negative Coggins test. And those are the things they can take to prevent the illness. Thank you for your time.